It's working. Hi, everybody. Thank you so much to the Children's Cardiomyopathy Foundation and to Dr. Lynn for inviting me here today. I'm going to talk about a topic that many of us experience in one way or another, the teen years and the transition to adult care. So I want to start by just giving, let's get the angle here, let's talk a little bit about transition itself versus transfer of care. So the definition of transition: the purposeful planned movement of adolescents and young adults with chronic physical and medical conditions from child-centered to adult-oriented healthcare systems. The most important piece of this is, about it being, I don't know how to go back. There we go. Is that it being purposeful and planned. And the big difference between a transition to adult healthcare versus a transfer to adult healthcare is the goal of transfer really is the person attends an appointment in adult healthcare, where on the other hand, transition is really a thoughtful, planned process where the young adult goes into adult healthcare with the skills and the ability to independently manage their own healthcare. And what we know from research is that the abrupt transfer of care, so the transfer without the transition process, can really negatively impact the health of young adults, and that we are all, patients, parents, caregivers, healthcare providers, are all responsible for helping the successful transition of our patients. So why can't we just keep adult patients in pediatrics? I think that's a question that a lot of people ask. Why can't my kid just stay, or the kid themselves, I really like it here at Children's Hospital of Philadelphia or wherever they are, why can't I just stay here for a really long time? And the first thing is that it really conflicts with the developmental norms of adulthood. Adulthood is about learning to make decisions on your own, learning to develop your own identity, making your own choices and responsibility, and that's not something that we typically encourage as part of pediatric healthcare. Second, the transition to adult care really sends the message that young adults are capable of self-management. And I'll talk a little bit about what we mean by self-management in a moment. And third, our pediatric providers are fantastic, but they're really not equipped to deal with adult medical issues. They are experts in pediatric care. Come on. So when we think about self-management, and I'm going to give some examples of what that means in a moment. So as our pediatric patients get older, we expect them to take more responsibility for disease management. And I think the most important thing to think about here is that, yes, disease self-management is very important, that this happens for different kids at different ages. And I'll give an example of that in a moment too. We want this to be a gradual, planned process, and that it's really important to take not just their age, but also their developmental level into account. So for example, not all 15-year-olds are created equal. I've met many 15-year-olds who are really capable of managing their own medication regimen, who call in refills, who schedule their own doctor's appointments. That's not really typical for 15-year-olds. Most 15-year-olds are not able to do that without a lot of help. So what we try and do is think about where the patient is at, but we would not expect a 12 or 15-year-old to be able to do some of the tasks we might expect of an 18-year-old, and also think about who that teenager is as a person, or young adult, or pre-adolescent, and then start from there. Oops. So what do we want our young adults to be able to do eventually? So our goal is for them to independently follow a medication regimen, calling in refills, being able to ask the medical team questions about their own health care, schedule appointments, know how to seek out information about their illness and their care, to be able to see medical providers alone. They can choose not to, and that's okay, but we want them to be able to know about and follow healthy eating habits related to their illness, to be able to plan for school or work or whatever their future might look like, to be able to understand health insurance issues, as well as any of us grown adults can really understand health insurance issues, and then also to understand issues related to sexual health and reproduction. So this is something that's really important and something we think about a lot. And one of the reasons that we spend so much time thinking about this is that the transition to adult care is the time of highest risk for worsening of illness. And the reason for that is late adolescence is also the most common developmental period for poor adherence or poor following along with your medical regimen. So here's the reason for that. How many teenagers do we have in the room? How many of you are teenagers? How many of you are parents of teenagers? How many of you have a history of ever having been a teenager? So just about pretty much everybody. So we call it the paradox of adolescence. So adolescence is a time when people typically are at their healthiest. Your immune system is nearing your strongest. Your body is very strong. You typically have a lot more energy than other age groups. However, we see that overall morbidity and mortality, so risk of bad things happening, not just related to your heart health, but related to everything, increase from 200 to 300% from mid-childhood to adolescence. And the question is, why does this happen? Oops. So one of the things we know about adolescence is the psychology of the adolescent. Adolescents are at an age where they're really seeking autonomy to be able to make decisions on their own and think about their identities of themselves as separate from what their families are. They look more to their peers than to their parents to make decisions and for acceptance. And their orientation tends to be more about what's happening right now than more towards the future. That gets better as they get older. However, at this age, it can be very challenging to think about future consequences of current behavior. And there's a really good reason for that, a very good biological reason for that. And it's called the frontal lobes. So the frontal lobe is here, the front part of the brain, and it's responsible for something that we call executive functioning. And executive functioning is the sort of category of skills, including planning, decision-making, impulse control, and having goal-oriented and future-oriented behaviors. The frontal lobe is the last part of the brain to grow because it's the least important to actual survival of a human being, but it's most important to doing all the things that you need to do to take care of your health and body in adulthood. And it grows and changes during adolescence. In some cases, it does not finish growing until folks are in their early to mid-20s. And again, it also grows at different rates for some people, which is why we see some 15-year-olds with really advanced ability to manage their own healthcare and decision-making, and some who are in their early 20s and still struggling with that skill. So when we often think about, teenagers, they know what they're supposed to do. Why don't they do it? And it's because the part of the brain that actually stores information, the temporal lobe, where they might learn about their illness or they learn what they need to do or why it's important to take medication, is different from the part of the brain that actually needs to do the kinds of behaviors and tasks to be able to carry out what they need to do. So it's not about knowing what to do, it's about doing what you know. And the doing part is the part that can be very challenging, but thankfully the part that we know a good bit about and how to help with. So in general, when you look at adolescence, we think of it as a bit of a risky business. So if you look at, we've got 3 domains here. The first is sensation seeking, so the desire for novelty, for excitement, for the roller coaster experience, starts to grow. Whoops, I don't know how that happened. Oh, there it is again. Starts to grow around 14, peaks around 17, 18, and starts to decrease in early 20s. At the same time, the ability to take a future time perspective, so to think about the consequences of my behavior now and what might happen in the future, steadily grows from 14 to 22 with some little bumps in there. And then the ability to delay gratification, to put aside what I want right now because I know that it's really going to be important for me in the future, steadily increases from 14 to 22. So unfortunately, at the time that we often start to make that transition to adult healthcare is when our adolescents are in those peak periods, and they are not at the stage of an adult in a number of these domains. So when we ask teens why don't they take their medication, and or follow other healthcare tasks, and lots of research has looked at this, and when you look at the different answers, they really go along quite closely with what we know about adolescence. So forgetting, that's a big one. And that's a lot of reason adults don't take medication either. Not really understanding why they need to take medication. This one is fairly classic for what we'd expect from an adolescent brain, really believing that nothing bad will happen. It's kind of this myth of invincibility, or that it's not a problem. Adolescents don't like to feel different from their peers. They don't feel sick, so they don't perceive the need necessarily to take medication. They don't like how medications make them feel or look, if there's side effects that are unpleasant to them, and they think they can kind of get away with it. They think that doctors or nurses won't be able to tell if they haven't taken it. And what we know with many of medications that folks might take for cardiomyopathy, or I work a lot with patients who have received organ transplants, is if you miss a medication, there's no immediate effect. You don't immediately get sick. It's not until much later on when you've missed several of them that there's an impact. So what often happens if you miss a dose of medication and then nothing bad happens. And then it makes it hard to not miss the dose of medication next time, or harder to think that there might be a consequence of missing it the next time. So other factors that we know influence adherence. One, which I'm going to talk a bit about, is parental involvement. And this really ranges from not enough parental involvement, which I don't think is the case in a bunch of folks coming to a cardiomyopathy conference. But these are the, parents that aren't really engaging with their kids around their self-management. Sudden change is something that we often see. I can't tell you how many times I've seen families where they decide arbitrarily, like my kid is 15 now, he or she should be able to take care of his or her own medication regimen. This can happen at age 12, at 15, at 18. In reality, they are not any better at it than they were at 14 and 364 days. And it becomes an abrupt process where there's been no ability for the child or young adolescent adult to be able to learn the skills that they need to be able to make that transition successfully. And then the other factor that we see is too much parent involvement. And when we see parents who take over everything for their child because of the understandable worry that their child is not going to be able to do it themselves, unfortunately, it doesn't help engender independence and the ability to learn skills in their child. So the key is trying to find that balance. And we'll talk a little bit more about what that looks like in a moment. Other things that influence adherence are mental health concerns, depression, anxiety, also a lot of family conflict, and then also developmental factors. So again, we would really take somebody's abilities and skills into account when we think about what they should be doing at certain ages. So how can we improve self-management? The one thing that we know for sure is that, I don't know how many of you are as old as I am and have seen Scared Straight, this documentary that came out back in the 80s, and essentially they took a bunch of kids who they thought were at risk for bad behavior, and they took them to jail to come and see a bunch of prisoners to see what that experience might be like and to try and scare them. And I think that what ended up happening is they took a bunch of kids that weren't really at high risk, and they didn't end up committing crimes anyway. But what we know is that Scared Straight does not work. And the reason that Scared Straight does not work is because, again, it's not about knowing what to do, it's doing what you know. So it's still really important for people to know the consequences of their behavior. So it's important to know if you don't take your medication, this could happen. Your heart failure could get worse, or whatever the consequences might be. However, just providing the scare without providing the skills or the how-to of how are we going to get you from not doing anything to doing more for your health doesn't work. And in many cases, it just leaves kids feeling more powerless and just feeling scared, but not really knowing what it is they're able to do or how to go about doing it. So what does work is trying to provide what we call tools for success. So providing gradual transitions and responsibility is something that we in the psychology world call scaffolding. So an example of that would be that, say, your 12-year-old watches you put their medications into the pill box. And then gradually they start to do it under your supervision. And then they do it by themselves, but you check it for them to make sure they did it right. And then to the point where you just start checking it periodically. And then to the point where they're able to do it themselves independently without your being involved in it. Teenagers who feel like they're a part of decision-making tend to be more actively engaged in their health care. Opportunities, again, to talk to doctors alone, even if they're under 18, doesn't need to be for the whole visit, but for part of the visit. Using tools such as pill boxes, alarm reminders, and then presenting information in engaging ways for adolescents. We tend to do a really bad job of that in healthcare, where we often show very dry PowerPoints to provide information to both our patients and families. So this is just an example. This came out of the University of North Carolina. They have a transition program for their kidney transplant patients. And just an example of some of the materials that they've created, which gives some of the tips that we use to help that can help kids remember to take medication and organize them using a pill box, setting phone alarms, trying to associate it with something that you do at the same time every day. So every time I brush my teeth, I'm going to take my medication. Every time I eat breakfast. Skills that really, and tips that work for all of us, not just for teenagers. So research shows us that, looking back, adolescents want, as they prepare for their adult health care, they want more information, but they also really benefit from peer support, peers who have been in similar situations, and adult mentorship, which was surprising to me. A pretty large study found that teenagers with different medical illnesses really wanted to have the experience to connect with an adult who had been through similar experiences. And when they surveyed adults who had already been past the transition process, they had wished they learned more about the long-term implications of their illness, information about employment and insurance, family planning, and also information about mental health concerns and how to best address them. So this is just a sample of transition guidelines. Again, this came out of University of North Carolina. Again, it really varies according to the skills of the kid, but the kinds of things that we would focus on by age. So at age 12 to 14, we might teach them to learn the name of their illness, to be able to list their medications, or at least have on them a list of their medications, learning more about adhering to their medication regimen and being able to take some small part in that, and to start thinking about what they might want to do in their future. And then as they get older, we increase it to other level skills, more focus on self-management, nutrition, insurance, issues of reproduction, and then as they get much older, thinking about ongoing support and new healthcare providers. Again, this is just a rough guideline, but we try and break it up by age. And the other important piece of this is to start early, that we really want to start with our kids at age 12 is around the time that we should start thinking about transition. So what can pediatric providers do to make the transition process better? So it's interesting, and I was looking at the research on this, and there's many different programs that have been tried. So one-time workshops, group information provided over time, so some kind of like group program, different types of technology, apps, websites, one-on-one teaching. And what the research has showed us is really no one is any more effective than the other, which is interesting. What really matters is that it's individually tailored, so that one size doesn't fit all, which is what we've talked about. You really have to match it to the individual teenager and what their skills are and what their family situation is, that it's developmentally appropriate, and that it addresses both their physical needs as they get older, but also their psychosocial needs. So the role of parents. It continues to be very important. So I don't want you to think that your teenager or young adult moving into adult healthcare means that you can no longer have a role in everything that you've had such a large role in for so long. It's not so much of lessening your role. It's more important to think about it as changing your role. It's really a gradual shift from going from having a lot of control and making all of the decisions to really teaching skills, to have this important role in teaching skills and empowering your adolescent or young adult to be able to make some of these decisions on their own. So we like to think of the eventual role as more of a consultant to your young adult. And the key to that, again, is starting small. This transition process is not just a transition process for our adolescents, but it's also a transition process for our parents, who often have as much, or if not harder of a time, making that switch from the pediatric to adult healthcare provider. In conclusion, transition planning is a necessary part of clinical care for our children and adolescents and young adults. This process, it's extremely important that it's a collaborative process, and that it's a process, that we really start with this early and we continue on through that actual transfer to adult healthcare, and to remember that transition promotes health into adulthood. We're out of time, so I'm not going to show you this last video, but how many of you have seen the Goldbergs on TV? So I was going to give you an example of sort of the Beverly Goldberg sort of being the ultimate smother, as they call it, of someone who takes too much responsibility over every aspect of their child's lives, and that's not what we're going for. Thank you.
Thank you so much. I'd like to invite our